when I'm going through the records, whether it's for an independent medical exam or for a peer-to-peer medical record review, you're looking at the codes that the doctor's billing, right? You're reading the treatment notes, you're seeing what was wrong with the patient, what the exam looked like. You're also looking at the codes that they're billing. Were the codes appropriate or not? Well, where do we get these codes from, right? There are lots of codes out there, but for chiropractic, there's, really just a handful, maybe 20 or so codes that are the most common codes that chiropractors use. And this is Bible about them, CPT 2025. This is what we use that defines all of the codes, okay? So I don't make up what these codes mean. It's in that book, right? So for instance, therapeutic exercises is code 97110, and that's to work on strength, range of motion, right? Get the patient moving, right? Whereas therapeutic activities, 97530, that is doing kind of whole body movement, right? Dynamic movements that you're looking to increase functional improvement in very specific tasks. These are people who, this is the thing that you use to help people, lift boxes more appropriately, to reach for things in cabinets, to wash themselves, right? It's very specific tasks that you are having them do these dynamic movements through, right? This isn't, using the bands, to increase the strength, right? That's 97110. That's not increasing range of motion. You're trying to get them to functionally improve doing a very specific task. So, and a lot of people don't realize that. A lot of chiropractors will use 97530 interchangeably with 97110. And I'm reading the notes, I'm like, well, these are exercises, right? But they're billing 97530. And I can't say that that's medically necessary because it's not, right? The patient had no functional limitations on exam, right? They didn't complain of not being able to do certain things. Well, then that code's not appropriate for it. Now, had they billed 97110, that would have been medically appropriate and it would have been approved, right? So you have to be really careful on what you're billing. Neuromuscular reeducation is another big one that people use. They'll have someone standing on a vibration plate and then they'll bill that as neuromuscular reeducation. It isn't, not according to the definition in the CPT code book. Neuromuscular reeducation has to have one-on-one contact with a provider and a qualified healthcare provider, right? It has to have cueing involved. You're working on neural networks to re-educate neural and motor pathways, right? So it's not just have them stand on a vibration plate. No, that's not it. Sorry. That's when you're trying to retrain a glute firing, right? When it's it's more kind of dynamic movements, more for functional capacity versus just increasing range of motion and increasing strength and getting them kind of back where they were. So there usually has to be neurological deficits to do neuromuscular reeducation, right? They have to have a problem with their balance, or they have to have diminished reflexes or weak motor strength on testing. And most of the time, those things come as normal on the exam, and yet these providers are billing for these. Now, I don't think it's the provider doing something nefarious. I think they just don't know, right? Not everybody knows the actual definitions of these codes. Not everybody owns that book, right? But you have to be really careful on what you're billing versus what your notes are saying you're actually doing, right? Most of the time, it's going to be 97110 exercise. Certainly there will be times that you are doing neuromuscular reeducation for a patient, and there are times that you're doing therapeutic activities, which is the 97530. Yes, but not most of the time. And if you are doing those things, you have to really document. You have to document why you're doing it. You have to say, hey, this patient had, diminished reflexes and decreased motor strength at this particular level, so I'm going to work on this particular body part to improve function at, in this area of the body, right? That's a very specific reason. You've documented what you're doing, why you're doing it, right? You have to say, I did cueing with the patient to get them to do this movement or that movement, whatever. You have to specify. You can't just check a box on the form. That's not enough, unfortunately. That's how it goes. You have to be able to justify the things that you're doing in the office, and you have to make sure you're picking the proper code. So make sure that you're coding what you're actually doing, and make sure that you know what the definitions of these codes are. That way you won't have, someone denying care that should have if you had just billed it with this other code, it would have been perfectly reasonable, necessary care. Because you chose the wrong one, it's not. So please be careful. Make sure you pick the right codes. Make sure you're doing what's best for your patients, okay?